Good morning. We are back. Let me just move this down. Hey guys, I'm Sarah Lavonne and welcome to my YouTube channel. This month's Coffee and Questions, which is for March 2020, I am actually going live for it, clearly. For those of you that are on, thank you so much for being here. If you have missed it, the live portion, this will be available forever. Thanks to the coronavirus, we have all been sheltered and in place here at home. And so instead of having my videographer, editor, producer extraordinaire come and for us to be in close quarters, instead, we are going live and I'm going to be answering your questions from YouTube comments and then from Instagram. So a couple of things before I get started. I have your questions here. I threw out a poll over on Instagram, so if you don't follow me on Instagram, go on over there. Follow me on Instagram at Bundlebirth and everything over there. There's so much more information over there, guys. I am doing lives over there. I'm answering your questions. I try to answer your DMs. I'm giving other information and we are following up over there. So if you want to be in contact with me, that's the best way to stay in contact with me. That's number one. Number two is, I know thanks to the coronavirus, a lot of your classes have been canceled. You've been stuck at home trying to, occupy your time. I know myself included. I'm grateful for things like this because this has kept me sane because I love connecting with you guys and I have felt very sheltered in place given my extroverted self. And so I am so grateful to be here, but one of the ways that you can use your time is to take your childbirth classes. And so for those of you that are on today, I have a promo code that is live until the end of today. So this is just till the end of March. It is COVID-19 and it gives you 25% off all my classes. So today is the last day. Take advantage. You have access forever. So even if you're early on in your pregnancy, you can check that out and take some of my classes. I do have a new class on there that is specifically a response to the coronavirus stuff, which is infant safety and CPR. So that's disclaimer number two. Number three is I usually put a little screen on these videos that's disclaimer, I'm not your medical professional. I'm not here to give you medical advice. I will give you my education. I am a nurse. I am a birth coach. I'm a lactation educator counselor. I'm a certified childbirth educator. And so I, of course, I've done this a few times, but always check in with your healthcare provider if you have questions about anything. And last but not least, given the coronavirus situation, the pandemic on our hands, I have started a hashtag revolution over at Bundlebirth. And so if you are hashtagging your pictures, if you're in labor, what the hashtag is hashtag labor in the time of corona, which is actually a play on words based on love in the time of cholera. And so what we're doing is if you're in labor, we want to send you our love. If you've had your baby during this time that has been very interesting and kind of scary, and I don't want to put words in your mouth, but you've had some losses based on being pregnant and giving birth during this time. And so hashtag your photos at that. We will send you our love, guys. Follow that hashtag and send your love to these mamas. There was a mama that tagged yesterday that shared her story of delivering alone in the hospital. And it was just such a beautiful reflection of humanity and of how beautiful birth can be. And so it's a way for us to stay connected in this interesting time. Okay, so I am seeing your little comments come up. Hi, Ashley Tony from Ohio. So I'm seeing them. I'm trying to ignore them. So if you see me get distracted, that is why, because I'm so grateful that all of you guys are here. But I have your questions. So I have tried to plan ahead. Normally with Coffee and Questions, honestly, I open my phone and I'm and my poor Brian that's here helping me film is waiting and waiting, and I'm oh, how cute, oh, you're so nice. And that's the stuff that you don't see me do, so I tried to plan ahead to help save time. I'm gonna try to keep this video short and sweet, but if you've been on any of my lives, I always go the whole time, so I'll be here answering your questions. And I am on, my apologies, I did silence my notifications, but clearly they're still coming through. So excuse me for that. I'm on my massive iPad today because my phone is connected here with you guys. So this comes from YouTube. One of the more recent videos, this is all about coronavirus. If you haven't seen, I have 2 videos on coronavirus. I am due for an update, given the more information that we learn. So stay tuned over here, guys. If you haven't subscribed, click that little subscribey. My guess is most of you that are on have already subscribed. But I may be doing this depending on how long the shelter in place is in place. I may be actually here live with you more often. So let me know if you want more of these because they're very fun for me. So this is Tasneem Elisayeth. She says, I'm 38 weeks pregnant and feel a sharp pain in my cervix during walking, sitting, baby movements. Could this be changing my challenging my cervix, changing my cervix? So she's 38 weeks pregnant. Tasneem, I hope I'm saying your name right. Maybe, but more often than not, if you're feeling cervical pain in your vagina, and I'm assuming this is like kind of vaginal pain, especially if it's sharp, typically you're not going to be feeling your cervix change, okay? You're going to more feel pressure in your like vagina or your butt or your pelvis as time goes on. But with you being 38 weeks, I think it's very likely that that extra pressure down there is giving you some sensation. Actual labor is in your uterus. So like in your full belly, they may be sporadic or they may be more like controlled and rhythmic. P.S. I do have a client that looks like she's in early labor. So I would almost like postpone this, guys, because I was like, maybe I'll be in labor with her, but we're here. Stay tuned at Bundle Birth Stories because I will be doing as much documentation as HIPAA compliant over there and let you know how it goes because I will be laboring with them at home. So stay tuned over there. But for you, during walking, sitting, baby movements, it is not uncommon to have some sharp shooting pains. This is where exercise, this is where sitting on your birth ball. I had another comment come in literally a few seconds ago that asked, what can you do instead of a birth ball? And what I would say is the air, okay? This is gonna be really awkward. But if I were to pretend like I was on a birth ball, okay, and I would stand up and be a little bit higher, but you're gonna wanna do those same movements and just mimic them in the air. You don't have to squat down. I know, like, I'm here squatting, which could work too, but I would say just stand up and do some huge hip circles, some figure eights, stuff like that, okay? And I saw somebody ask about laboring at home. 100% I will be answering that question today. We're gonna talk about laboring at home, okay? How to stay home, all of that, because that was for sure your highest requested thing on here, okay? So it could be changing your cervix. It's probably not. It's probably just the baby pushing on something, okay? This comes from my vaginal tearing video, which now I'm like, I feel like I need to redo some of these. If you think I should redo them, let me know because I'm like, these are getting older and now I've been around for a hot second. Hannah Capehart says, with my first, I had a 1st-degree tear that went up instead of down, like up towards her pee hole versus towards her booty hole. She says, is that uncommon? I'm 36 weeks with baby number 2 and worried about tearing the same way. So if you have torn in the past, those tissues do have a little bit higher chance of tearing again because they've already been torn. It's like they're weaker, right? So I don't know, like if you've rolled your ankle, myself, perfect example, I did roll my ankle again, have a little hairline fracture. It's okay, just walking. It was a very dramatic story. I just walked and then fell. And so because I've already had a pre-existing injury on my ankle, I am going to be more prone to rolling my ankle again. It's kind of the same way with your vagina. Now, mind you, a 1st-degree tear is like a little like, it's like a little tiny little tear. It's nothing huge. And it is not uncommon for you to tear upwards towards the urethra. It may make peeing really uncomfortable. So that's where I actually got a phone call from one of my clients yesterday. And she was saying she was having some peeing pains. And I said, use your squirt bottle. So they'll give you like a little squirt bottle. I know Frida Mom, one of the two. They also have a new squirt bottle thing where you fill it up with warm water or cold water, whatever you want, and spray while you pee because then you're diluting the pee. The pee is like salty, it's acidic, not good down there, okay? You are more prone to tear again. A 1st-degree, I would say, honestly, that's barely anything and you probably won't tear with the 2nd. I wouldn't stress about it. It's not uncommon to tear upwards, more common to tear on the bottom part like vagina to booty hole, also known as your perineum. All right, so Jessica Glessner says, oh, this is perfect. I'm currently 34 weeks pregnant. I'm due to the virus, they canceled my childbirth classes. Would you please do a how to labor at home video? I appreciate your videos. They help tremendously. Okay, so we made it, guys. All right, let's talk about laboring at home. This will probably take up most of today's questions. So I'm gonna fly through the rest. because I know this is a concern. So first of all, you have to have the tools to labor at home. You have to know what to expect. You have to understand that there are different stages of labor that you work your way through, and that it's okay to stay home, that your body takes time. Now, I'm going to mostly speak to first-time moms. If this is your second, third, fourth, if it's like your fifth or sixth baby, like if your water breaks, please go. And if you have regular contractions, please go, because you may risk delivering at home, although for some, maybe that wouldn't be the worst thing in the world. Don't deliver at home unassisted. I have a whole rant on my bundle birth stories over on Instagram about that one. So for first-time moms, though, what I would say is you have to understand stages of labor. You also, every single one of you needs skills to cope. Given the fact that we are in a pandemic situation, we know that coronavirus exists. The virus is alive and well and infecting people where? In the hospital. So we want to avoid the hospital as much as possible. And so with that being said, what I love and what I'm seeing as the fruit in this time frame is the fact that this is going to really motivate you guys to stay home until the time is right, okay? Which is kind of hard to know. And so how I would suggest you knowing that, a couple of my videos that would be helpful that I think you need to review during this time would be when to go to the hospital, when not to go to the hospital, warning signs, that's a more recent one. That might be it, honestly. Oh, what does the partner do would be helpful. There's like a partner commitment one that would be helpful. How to engage your baby in labor would be helpful. There's a good amount of those. I can link them down below after this gets posted. But I also would say you gotta take a childbirth class. You have to take a childbirth class because that's going to lay it out from beginning to end. It's gonna help you to lower your anxieties so you can understand what's up, you can know the whole process, and then you gotta do some sort of coping practice, okay? You have to have some skills to know how to cope at home, because even if you plan on an epidural, you wanna show up about 6 centimeters, which is considered active labor. Because then your body's like, oh, hey, I got this. I know what's up. I'm gonna have a baby now. Versus in early labor, prior to 6 centimeters, we're like, it could take a day. It could take a few hours. It could take a year, not a year, just kidding, but a very long time potentially to get you there. And so it's a lot of times what I'm finding when I labor at home with people, I am stalling the heck out of them at home. And so first tip for laboring at home is ignore the heck out of it, okay? If you are starting to have some cramping, if you are having some discomfort, if you're having a lot of pressure in your vagina or some lower back pain or contractions, I want you to just say, yes, woohoo, this is currently what I'm doing with my client, and rest that you are ignoring. And then I want you to think about like, okay, so this is the part of my labor, first of all, that you've been hoping for. The number of my clients that are like, please go into labor. I don't want to be induced, especially because I am laboring with them at home rather than doing everything virtual, which by the way, I am taking a few more virtual clients. So if you need help, I can help you from afar. I'm doing that even for my LA clients. So hit me up on my email. I'll link everything down below in that way as well. But we're excited about labor. We're like, thank God, let's get through this rather than all the anticipation of what's it gonna be like, is there gonna be a bed for me, blah, 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 all the things going on in your brains, okay? Get home, snuggle your babies. Ignore the heck out of your contractions, okay? Drink yourself a liter of water. Unless you've been drinking like and pounding back the fluids, I want you to initially, when things start going, hydrate the heck out of yourself, because if you're a little bit dehydrated, you're gonna be more uncomfortable with the contractions and they're not gonna do as much to your cervix, okay? So hydrate, because if they're true contractions, you can be as hydrated as possible and it's not gonna do anything to space out your contractions. Your contractions will continue to come regularly, okay? So rest when you can. If you can sleep through contractions, ignore them. You go, yes, we're celebrating, ignore. I need to build up my stamina and my energy through some rest and sleep. Even if you can't sleep, I like to say in my childbirth classes that it's like the snooze button, that even if you're like, I'm falling asleep, oh, contraction, and now I'm awake. And then you go through a contraction for 1 minute of your life, and then, I'm back to sleep. I snooze every day, multiple times a day. And so I think it's great sleep, even though I'm sure it's not like the best sleep in the world, but it will help to fuel you for the longevity of labor. First-time moms, minimum 24 hours. On average, to get to 6 centimeters, you're looking at about 20 hours, okay? Second, third, fourth, more like 8-ish. But that's totally average. Flex and flow. There is no rule to this. It would be mostly what your sensations are, okay? Ignore, rest, drink your water, and then if you're awake or you can't sleep through them, get up. Get active, do the engaging your baby exercises, sit on your ball, walk, be crooked. And by crooked, I mean like put a leg up on a stool and then like rock your hips, dance in labor, connect with your partner, and then find your breath. This you learn in my Coping with Labor class, kind of gives you like a systematic, like when things start going, my first tip is find that breath, because if you lose your breath, you're not coping with labor. And so respond to the contractions with a breath, relax your body, and then get in that zone, get in the vibe, set your mood in your house, okay? And then let things pick up. And as they pick up, really tap into your instincts. This is where, like, instead of like life going on and like, oh, we're ignoring, eventually there'll come a time when like you're in labor land, and I want you to find labor land. We're gonna be so grateful for labor land. This is what you've been waiting for, okay? And so let your partner know, bring over whoever you're bringing over, so long as they've been isolating themselves. Drink your waters. Partners, you're fulfilling her basic needs. If she's rubbing a hip, you jump in there and you rub a hip. This you learn in my What the Partner Can Do video. Check that one out. And then until one of my criteria for going to the hospital, if I'm laboring with them, honestly, I don't even look at the clock. I don't time contractions. I watch their demeanor, okay? And so what the most important thing is what your sensations are. If every single contraction is super regular in the strength, where it's like, whoa, that one was so intense. The next one's, whoa, that one's so intense. And mind you, if you're looking like me when you're having a contraction, you are not in active labor, all right? You need to be all consumed, that it is taking all of your energy. There's no way you could talk through it. You're breathing, you're working, it goes away, you get a little breather, the next one comes back with just as much strength. Now, people like the numbers, and so they need to be regular. That's my tip, that as if they're like sporadic and kind of spaced out, which you learn in my When to Go to the Hospital video, then they're not ready, you're not ready yet. But if they're one after the other, where it's like you truly are in labor land, then it might be something to pay attention to. Now, if you've been doing that, typically my criteria is 2 to 4 hours of that, okay, when I'm with them. Now, I know in my childbirth class, I say 1 to 2 hours like that. Your doctor will probably say 1 hour like that. So this is where I want you to check in with your doctor or midwife and ask them what the criteria is now, given the fact that you want to labor at home as long as possible and show up and not have to do the like go home, come back, go home, come back thing, and then bring all the hospital germs with you. We're not doing that anymore, okay? So when in doubt, stay. The keys of tips of like when you gotta go, if I was laboring with you, would be you've been having super hard contractions where you're okay, and all of a sudden you're like, wow, I gotta push, oh my God, this baby's coming. Hey, you have sensation. You know what's going on down there. You may not know exactly what's going on down there with your cervix, but you're like, no, there's something in my butt. There's something in my vagina. I gotta go, okay? Because we don't want you pushing your baby out. Now, I'm not telling you to check yourself, but worst case scenario, if you think this baby is coming, wash your hands and put your fingers up there. And if you feel ahead, get yourself in your car and go to the hospital, please, okay? The other thing is, if you've been laboring super hard and your water breaks, make your way that direction, okay? We're not lollygagging because there's no longer a barrier between cervix and baby. Now, baby's head can smack dab on that cervix, and then a lot of times you speed up in labor, okay? Water breaking after hard contractions that are super regular, we're moving, or you start to feel rectal pressure, or you are suffering. So this is another video I would say that would be helpful, would be the should I get an epidural or not, I think is what it's called, but it's basically pain versus suffering. I don't want you emotionally distraught from this. I don't want you looking back and saying that was the worst day of my life. This is awful. Oh my God, I'm suffering. We're not using those words for labor. You get to choose what emotion you attach to a circumstance. I think I said this in a previous video. I've been saying this all over social media. And that's been a lesson for me. It's been a personal challenge to me that like, I can say this is so scary, which I know I said, I apologize. Or I can say this is suffering. Oh, I'm just gonna suffer my way through. Or I'm gonna decide, no, I'm gonna be uncomfortable and I'm gonna embrace it and I'm gonna kill this game. It's gonna be so good, it's gonna be so fun, and I'm gonna make it to the other side and I'm gonna snuggle my baby and be skin to skin. And I'm currently in labor. We are sending you so much love and so many hugs. I always wanna hug all of you guys. I wish now I really wanna hug people now that we can't, but we are sending you our love. Hashtag labor in the time of Corona. Bless you, you can do this. We are cheering you on. I happened to see that comment. She is in labor right now. What a great distraction, okay? So keep distracting yourself and then go when the time is right, okay? The other thing is, have a resource to tap into, whether it be like a YouTube video or whether it be your virtual doula, because I also think that, like, especially for laboring with people virtually, that there's the comfort in being able to ask those questions and being able to say, like, is this normal, is this not? But that's where education comes in, okay? And Gladys, congratulations on your pregnancy. She said she's finally pregnant. Yay, congrats. Okay. So I hope that answered your questions. If you guys have more laboring at home questions, put them in there. I may see them. I hope to see them. We'll see if we have time at the end. All right. All right. Labor at home. I'm just circling all your labor at home. Okay. So Alyssa Potter says, some people can be infected with the virus though and not have any symptoms. So what if once you come home, your baby gets sick like a week later? How do you know if it's just the common cold or the coronavirus for your baby, and whether you should take them to the hospital or just treat them at home? Okay, so let's reflect back on the coronavirus and some new updates, okay? If you are sick with the coronavirus, it is possible, in theory, you can get infected anywhere. So this is where good hand washing technique, limiting your exposures once you're there, making sure your nurses are washing their hands, which I can't imagine they're not, but let's just say, like, make sure they're washing their hands. And then once you get home, I am suggesting to my clients that they quarantine for 14 days for the sake of themselves, for others. And then also, you don't know where other people have been. I am so like anti the world right now because I so desperately want to be able to labor with my clients that I haven't seen or done really anything. And even if I'm walking outside, I like cross the street. I'm that weirdo that's like, oh, no, stay away. I want 15 feet instead of 6. You know, and so it's just better safe than sorry. Now, if you notice that your child has a fever, and this, you would learn a lot about this in my infant safety and CPR class. You know, how you learn how to recognize if they're sick or not. So if you notice that they have a fever in general means a lot of things for newborns, okay? So if your baby has a fever, you call your pediatrician, and your pediatrician is going to talk you through what that looks like, okay? Because they may not have a cough, they may just have a fever. And then you want to make sure that they're breathing okay. So color for an infant is really important no matter what, whether we're in a pandemic or not. They need to be pink from head to toe. Now for the first 48 hours of life, their little hands and feet may be a little bit blue. That's okay. That's just their body getting used to using their own circulatory system. But after 48 hours, really their entire body should be not mostly pink. Their core should be pink. Occasionally, like if you got an arm while you're breastfeeding or something, their arm might fall asleep and turn kind of bluish. Don't stress about an arm or a limb turning blue for a hot second so long as it comes back. But their core should be pink, their face should be pink, around their mouth should be pink. If you're noticing any kind of like ashen color, blue color, that's not okay. You need to call your pediatrician and they will advise you accordingly because there's so many things that go on. And one of the first things for a newborn or an infant or even a child is that they spike a fever, okay? All right, Lexi Graves, I see you. Lexi is very active on this YouTube channel. I love you, Lexi. You make my day. You're so enthusiastic about everything, and she has been asking me to answer her question for like multiple months of Coffee and Questions. So I see you. I remembered this time. It's mostly because I do this very spontaneously and it's kind of like whatever comes up. And she says, I love you so much. You're my absolute fave ever. You're so, okay. I'm just wondering, when are you going to answer my question? She says, about breaking the partner's hand during labor from squeezing it too tight. And I did respond to her because I was like, that's actually a fun question to answer. So her original question, if I remember right, was, can you break your partner's hand in labor from squeezing them too tight? And I actually have a story from this. My OB, so like labor and delivery obstetric nursing professor, had her fingers broken while she was in nursing school holding a mama's hand while she was in labor, okay? You don't even know your strength, all right? So the tip is, my fingers are back out. And by the way, my nails are so much shorter because I am checking my patients if their doctor gives me permission. I have a whole new protocol for that, so we can do that at home. So my nails are a little shorter, not quite as intimidating as before. And 2 fingers is my rule. So if you give them a hand to squeeze, for the partners, give them 1 or 2 fingers. Try this on yourself. Squeeze as hard as you possibly can on 1 finger. It's fine. 2, now squeeze 3. That's when you start to smush them together and it really starts to hurt. So 2 fingers, 1 finger, that's my tip for you. Otherwise, you actually can break their fingers, which we definitely don't want. Keep those fingers nice and well, okay? So this comes from warning signs when to go to the hospital. This is the sad one. Harvest Gleaner. She says, my husband and I lost our baby girl to stillbirth on February 22nd, 2020 at 39 weeks pregnant. She was 7 pounds, 12 ounces. I wish I had understood that I should not think of myself as paranoid and that large babies with no room still do move. I thought I felt her moving, but I was really just feeling pressure. It's not the same as movement. We don't know the medical reason behind what happened to our baby girl. I'm concerned about future pregnancies. Our baby can never be replaced by another, but we are still ready to have a baby. How soon can we try again? And should I be allowed an early induction this time? So I considered not answering this question just because I really try hard not to scare you guys, but at the same time, let's talk real and let's like love on this mama. If you see this question, this is on the 3 warning signs for pregnancy. If you see her, please go and give her your love and send her like all of our hugs and love. And Harvest, I'm so sorry for your loss. I know that doesn't replace anything. There's like really nothing we can say other than that. I am so sorry. That is the hardest thing to go through, okay? And so I would say agreed, yes, it can never be replaced, but if you are feeling ready, the recommendation is if you've had a miscarriage, if you've had a stillbirth, that when you feel emotionally ready is when you can start trying again, okay? Now, if you, like once you've had a baby, you need to ovulate, so it may take some time before your body kind of re-regulates through their hormones, but if you're feeling ready, go ahead and try again, okay? And then, because of your history, if you have a history of stillbirth particularly, this doesn't really apply to miscarriage unless it was like a later, which would be considered like a stillbirth, that you would be a candidate for an early induction. And I would say from the clients I've worked with this history, that it may be better for your mental health to know that like at 39 weeks we are having this baby, or even 38 weeks, they may make an exception depending on who your provider is, because of just the stress of every single day and obsessing over the movements. This is why, guys, one of the best signs is that your baby is moving. Now, I don't want you obsessing about this, okay? But if you are feeling like you're not feeling your baby move, it is something to pay attention to. So I talk about this in the warning signs video. I'm not going to repeat myself. You can go watch that video. But Harvest, we send you our love. If you are feeling ready, go for it. And yes, you would be a candidate for an early induction if that's what your choice is. Okay, so I've made it through my YouTube questions, but I'm going to go over to Instagram and pull up. This poll came from forever ago. So if you probably don't even remember if you put a question in there, but we'll see what comes out, okay? Okay, so Shauna Rowley says, are there reasons for back labor? A back labor video is like really in my queue, guys. If we ever get to film again, that one is on the list of what I will film next. I have like 3 or 4 videos already filmed that will be coming out in April. There's a breastfeeding one coming. There's a breathing in labor one coming. I don't remember what else we did, but it was good. So is there reasons for back labor other than baby being OP? Occiput posterior, meaning the back of the baby's head is towards the back of you, towards your tailbone. Can it be hereditary? Hereditary is super unlikely. I suppose, like, depending on the shape of your pelvis, if your mom had back labor, like, because of the like dimensions of your pelvis, which, hold on, let me get my pelvis. 1 second. It's like right over here. Okay. So I got my pelvis. I need like a pelvis necklace, or I need like a little travelable one that moves, because I really should just bring this with me. Now, so if you're like, back labor is not uncommon, but what matters and what's happening with back labor is that the back of the baby's head, so imagine like my thumbnail is the back of the baby's head, is facing this way and pressing on your tailbone. Can you see this? So it's pressing this way. Now, you may have a baby that is facing the back, or you may not, and you still can have back labor. Your baby can be facing the back and you not have back labor. And by back labor, I mean that you're feeling most of the contractions in your back, okay? And so, Harvest is on here. Oh, Harvest, yes! I am so glad I saw that comment. Oh my gosh, so much love to you. Okay. And what the reason for the back labor is that because the baby's pressing here, it's pushing this sacrum, this bone, which moves in labor, which we want it to move out of the way to let the baby in. Look at how much bigger that top hole is compared to that. It just closed off, right? So we need it to move, and then as baby comes through, we need the tailbone to move out of the way, which is super cool, right? How amazing are our bodies? But in here, on our tailbone, there are these ligaments that connect to the sacrum and the tailbone, okay? And as the baby comes down, it may pull on those ligaments. So if there is tension in your sacrum, in your butt, in your lower back, you may have some sensations in your lower back. Also, as this thing moves out of the way with your spine, okay? So this is where counter pressure, super helpful. Listening to your instincts is super helpful. More to come on that one, but it may just be that you have tension in your pelvis. This is why exercise in pregnancy is so important. By exercise, I mean stretching and walking. That's all you need to do. I mean, you can do more than that, but if you're doing nothing, don't think you have to like start doing CrossFit or like do some crazy exercise regimen, okay? Do a prenatal yoga class online. Walk around the block, okay? All of that movement, I say motion is lotion. We wanna lubricate everything up and get things nice and soft and stretchy, and that's going to help with any discomforts of pregnancy. The other thing I talked about actually on my Instagram live yesterday, I'm looking for a tennis ball, which I cannot find. But imagine like a tennis ball, if you have a tennis ball or a lacrosse ball or even like a myofascial release ball, if you just sit it under your butt cheek, and I did this yesterday, excuse the booty shot, okay? So if you sit it like on my butt crack to my sits bones, which are down here, and right smack dab in the middle, which I'm very tense there. I actually have been having some sciatic pain myself, probably from all the sitting that I'm doing these days. But if you wanna just sit on a hard surface and roll it and just put constant pressure in your butt, that's gonna help with any discomfort. This goes for pregnant people or non-pregnant people, okay? That's my tip for you there. Okay, Dar Lawyer says what to do when month-old baby is breastfed and hasn't pooped in 5 days. So let's talk about your breastfeeding poops. Okay, if the breast milk poop or the poop of the breastfed baby still looks the same, like it's still that soft, seedy texture and it's not like firm and hard when it's coming out, you're probably still okay. Babies have fluctuations in their pooping cycles, okay? 3 days is usually the max. 5 days is a lot. At 5 days, I'd say call your pediatrician. But typically, you know, we want a few poops a day. 3 to 4 is probably what you're getting now, but there may be a random day where your baby doesn't poop for a minute meaning like a day to 3 days, and it's probably fine. This is where like a little bit of gentle abdominal massage is really nice, pumping their legs, thinking about your diet. Sometimes things that you've been eating that go into the breast milk can affect their poops. 5 days is not entirely uncommon. I wouldn't necessarily be worried. You can call your pediatrician. I'm not giving this recommendation, but like even prune juice for a newborn can be helpful. But otherwise, don't stress about it, okay? Can I explain post-epidural headaches? Of course I can, no problem. So this comes from Nyeri Bird. And she said, so post-epidural headache is a side effect that can happen. We call it a spinal headache. And so what happens is when you get your epidural, they have to imagine your vertebrae, which actually you can sort of see here. Like imagine there's like this bone, and then there's another one of those on top, and they bend. So when you lean over, they open up and you're accessing the epidural space in your back, all right? And that epidural space is an empty space. There's nothing really there until you make something there. Past the epidural space, so say it's here, this is like outside world, they find the epidural space. If they go through the epidural space, the next is the spinal space, and there's spinal fluid in there. The spinal cord is higher, so you're not worried about necessarily hitting the spinal cord. Everyone's worried about that. But if they accidentally puncture, which it's a blind procedure, it can happen. It's not the end of the world, but it can make for a headache. If they puncture that lining into the spinal fluid, you won't necessarily feel anything right away, but once they take out the epidural catheter, because there's a catheter, like a little tube blocking that hole that they punctured, when they pull it out, some of that spinal fluid that's in your spinal cord can actually leak into the epidural space. And what happens is there's a decreased pressure in your spinal fluid, and your spinal fluid goes up from your spine into your brain and cushions your brain. So imagine like water in your brain. So like when I shake my head, rather than my brain like bang, bang, bang on my skull bones, there's like some cushion, there's some buoyancy where like that water pads the brain so I can move and I'm not like, oh, my head, right? And so unfortunately with a post-epidural headache or a spinal headache, there's less pressure of that fluid, and so you feel a lot of tension and pressure in your head. A lot of times it's positional. So you sit up and you're like, oh, my head, okay? It's not the end of the world. You will survive. Typically it will be self-resolving in about 2 weeks, which a 2-week headache is just a recipe for being totally miserable. So typically what they do instead is what we call an epidural blood patch. And so this is actually live. Katie, I see you. And now I've just proven it. And so what they do is an epidural blood patch where they set you up in that same position for your epidural and they draw out some of your blood. Talk about who created these things and who finds these treatments to problems. And so they inject some blood in that area, and it blocks off that hole, and it's almost instant help. Okay? So that's your epidural post-dural headache. Nissy Michael says, I'm 6 months pregnant and I had a cerclage. What should I do? To have a natural birth. Love from India. So Nissy, if you've had a cerclage, so cerclage would be given to a mama who has what we call an incompetent cervix, which is like a horrible terminology. But basically they dilate, their cervix dilates too early, and a lot of times they have a lot of history of losses. So they throw like a stitch around the cervix to like suck it closed, and then when you're term, they just snip the little stitch, and then there's no longer anything holding the cervix closed. Honestly, you have a higher chance to me of having a vaginal birth if you've had a cerclage, and you need to be ready that you could go pretty quickly if you truly have an incompetent cervix. Because once that stitch is out, typically you may go into labor and that baby may come down and you may actually deliver. So you're good. You just need to get the cerclage out around 38 weeks or 37 weeks, depending on who your doctor is, and then go from there. Super quick answer. Michelle Clopton 9 says, I've never had period cramps before. Does this put me at risk for uterine atony or after birth when the uterus is weak and doesn't close off the little openings? No, it has nothing to do with it. Totally separate. Not a big deal. And then Monique J. McFarland says, thoughts on elective inductions during this pandemic. So I did want to follow up about this. I had a client who was electively induced this week, because the stress, when we weighed the two, we meaning her, but I helped with the education, it was like, look, this is your experience of waiting for labor, and this is your experience of being induced. And she said, you know what, to the stress of particularly her being concerned that her partner wouldn't be allowed in the hospital, it was like, I'd rather get this over with and induce and take the risk of induction than to not. Now, there is no more elective procedures in the United States, and elective induction is a little one of those gray areas. So if you are still allowed a elective induction, if your hospital is still doing that, that may be an option for you, but otherwise, I would say expect it to become not an option as time goes on and as our hospitals start to fill up. But if that makes you feel more comfortable given this situation, then totally your decision, and I don't think it's a terrible option. J Mel's 3101 says, why am I looking 9 months pregnant at 6 months pregnant? Does this have a risk for diabetes? Nope. People carry their pregnancies differently. Honestly, not a big deal. And it doesn't necessarily mean gestational diabetes. You need to be tested, but past that, especially if it's your second, third, fourth baby, you may just show a little bit earlier than you did with your first pregnancy. Totally normal. All right. Tips for relactation. This one is a full video coming, okay? If you have been breastfeeding, or maybe you breastfed and then you stop breastfeeding and you're like, ooh, I want to go back to breastfeeding, then you can. Actually, it is possible to relactate. It's actually possible to lactate even if you haven't had a baby. Makes for a lot of work, and you should. There's like, I forget, doxy something medication that helps with that. But if you have stopped breastfeeding, the best chance is if you've stopped breastfeeding within the last 4 months. Somebody just asked me, Mi Vida Bellísima says, why relactate? That would be a personal preference. You may be like, you know what, I miss breastfeeding. Maybe you stopped because it was hard, or you were overwhelmed, or a lifestyle thing, and now you're home with your baby and you're like, I wish I could breastfeed them. You may realize that formula costs a lot of money, and so that's, you're like, oh, well, I don't want to spend the money, especially in this situation with the way life is right now. I mean, there's lots of personal reasons for that. So if you want to relactate, all you need to do is bring the baby to the breast or pump every 2 hours around the clock for days. Okay. Now, if you're stimulating lactation from scratch where you haven't even had a baby, then you need to do that. Expect like at least a month. It is a full-time job. Now, mind you, the other tip I have for you, and again, this is a full video, would be, first of all, you have to stimulate the breast, whether that be pump or baby. Also, pacify your baby on the breast. So if they're wanting to just snuggle, and they're kind of going for it, give them the breast and just let them suck on it. Now, you don't want to have them on your boob for 5,000 years, you're going to risk your nipples getting really sore and cracked and dry and bleeding, and we don't want that either. But occasionally, you want the more stimulation on the breast, the better, and the more frequent, the better. And if you're patient with it and you're consistent with it, and that's the key, is that even at night, you got to set an alarm for 2 to 3 hours and pump 12 times a day is what I usually tell people. You can probably get away with 10 to 12, but if you're really trying to do it, then 10 to 12 times a day, stimulation on the breast, whether that be baby at the breast or a pump, and you will start to see some milk come back, and then you keep doing it, and then your milk volume can actually bring its way back up. Cool, right? I see somebody saying maybe birth control. That is something to consider, that if you have started a birth control and you notice that your lactation levels, your breast milk supply has gone down, then that you may want to check in with your provider and talk about maybe switching. Typically, if you're breastfeeding, you should only be on a progesterone-only pill. If you've started the pill and maybe you were done breastfeeding and you're wanting to relactate, you got to go back to a progesterone only, okay? Hi, Carol from Brazil. Oh, okay. It has been 42 minutes. Maddie, I see you asking a lot about torticollis. Torticollis is where they have tension in their neck. Super, super easy answer is tension in their neck where they prefer one side over the other. I would do tummy time so this is, there's a lot of things I could say about that. Number one would be tummy time every day, and then you sit on the side that they need to turn towards, that they have that tension. You could go to a chiropractor. I see you asking that question. An infant pediatric chiropractor at this time in the day and age with nobody being in practice right now, probably not an option. But you're gonna wanna just help your baby to favor that other side. The other thing is breastfeeding positions, which breastfeeding can be really hard with the torticollis, where they prefer, and they have a tension in one side where they're like, I just wanna be this way, rather than straightening out, and it's harder to turn one way or the other. So yes, chiropractor's fine. Breastfeeding in positions that forces them to kind of pull that other direction and encourage that. The other thing is sleeping. Your baby is typically, when they're sleeping in your room, which they should room in for at least 6 months, more like a year is what American Academy of Pediatrics says. that you would have them sleep, and then whatever way you're trying to encourage them to go, that you would be on that side, because they're naturally going to turn their head towards you. Even if they don't want to, they're going to favor that side, okay? But talk to your pediatrician about it. It can be fixed. There are ways around it. That's what I got. I see Megan asking about a VBAC in this pandemic, and I would say that, yeah, it's still an option, especially if you still have a provider and you have option, like that's something they do in their hospital. Like, nothing changes, guys. You are going to the hospital. You are, I see your questions coming in now, and having your VBAC, okay? Don't let that affect your birth memory. Prep yourself, set yourself up for your VBAC, and then nothing really changes, honestly. It would just be that, like, maybe laboring at home, you wouldn't labor at home as long. Okay? Okay, guys, I would love to stay on, but at the same time, I'm like, this has gotten very long. So if you want more lives, let me know in the comment box down below. If you need more from me, you know my spiel, but it is still there. I am here for you. I'm taking virtual clients no matter where you're at. I have online childbirth classes. Use the promo code today for COVID-19 for 25% off. Go ahead and follow me on Bundle Birth at Instagram. Please subscribe. Thank you guys if you do subscribe and you do follow and you are here. I so appreciate you guys being here. You are so fun. I cannot wait to go back and read every single one of your comments. I've sort of been seeing them come in. Thank you, Nicole. I see you. I love you too. Flex and flow. I love it. So you guys are the best. Literally, you keep me going. If there's anything that I can be doing to help support you, if there is a resource that you guys need, please let me know. I can do more lives. I'm doing posts over on Instagram related to this pandemic. I want to support you through this, and I've been so burdened. And I've said this so many times, I've felt such urgency and just such a burden for you guys who are pregnant, because this has been somewhat sudden and unexpected. And so for you to have to do some serious like mindset shifts and adapting to the circumstance, I want to adapt with you. I want to be here for you. I want to answer your questions. I want you to have the support that you need, okay? And so let me know, all right? I wish you the absolute best. You guys can do this. If you are close to delivering, and you will deliver in #labor in the time of Corona, I am cheering you on. I wish you guys the best. Thank you so much for being here. And then until next time, don't forget to flex and flow, and I will see you soon. Bye, guys. I don't know how to end this thing.